The Expert is sponsored by Intermountain Healthcare.
Well, luckily the air is nice outside, and so if you have breathing troubles, probably not as bad as it will be likely in the months to come. But today we have the experts in house today answering questions about asthma.
Dr. Thad Abbott here, asthma and allergy physician from Utah Valley Hospital. Thad, thanks for joining us today.
Yeah, thank you for having me.
I have asthma, so I know how to determine whether I have it or not.
Great.
But a lot of people don't.
Yeah.
How do you determine if you actually have asthma and it's not like allergies or just short of breath?
Well, I think in order to understand that, the best thing is to talk about how the lungs normally function. The lungs have airways. They have what we would consider basically tubes that are able to move air in and out very easily. And in asthma, those tubes can become inflamed, and that inflammation causes swelling, mucus production, and a number of other things that happen. That causes narrowing of those tubes. That narrowing doesn't allow the airflow to move in and out very easily. Because of that change in airflow, you get symptoms like coughing, wheezing, shortness of breath, chest tightness. So if a person has those type of symptoms, they very well may have asthma and should probably discuss it with their doctor.
So go to your family doctor first and then maybe see a pulmonologist after that, or what's the best option?
I think that if you're just now discovering or feeling like you have asthma, you have these symptoms, you're not sure if you have asthma, a good place to start would be with your primary care. But if you know you have asthma and or you have difficult to treat symptoms, then maybe seeing a specialist in asthma, such as an allergist who has that additional training in asthma and allergies.
Perfect. And I know it's a big concern for a lot of people when the inversion comes in the air.
Yeah,
Avoiding that probably a good idea, but what else can be done for asthma if you have something that's induced by the winter or the smog or anything else going on?
Well, really, the main treatment for most asthma is medications, and the most well-known medication probably are the inhaled type medications, directly to the lungs, help reduce that inflammation and that swelling. When the inversion comes in, the pollution, we're talking about those small particles that really that really aren't visible, that deposit themselves into the lungs, causing that inflammation. The best way is to really avoid it. Be indoors, be where the air is filtered, and that the same goes for during the spring, summer, and fall seasons with pollens, when the pollen count is higher. Staying indoors.
All right.
And lucky for you, if you have more questions, we've got operators standing by from Intermountain Healthcare right now. There's the number in our lobby. You can call them right now. They're available live, 877-908-0680 for your health-related questions.
And we will be right back. Doctor, thanks.